we give any target for measurement of amplitude of accommodation. Okay, so slowly what happens, slowly this target is like brought towards the from the examiner side. Slowly we move the targets towards the patient's nose. Okay, and once the patient reports the first sustained blood, that is the point what we noted down for amplitude of accommodation, right? So we tell the patient that it's letters, you fix it at this letters, okay, and read it aloud and tell me when it gets blurred. Okay, so when it first gets blurred, when the letters first gets blurred, so what happens, the patient, you tell the patient to blink and see whether it gets clear or not. So if it gets cleared, if the patient can make it clear, you can move it further, right? And then when the patient reports that no, it is completely blur, it is blur, I cannot make it clear, that means that is the first sustained blur. So what is the end point of amplitude of accommodation measured in RAF ruler? That is the first sustained blur when the patient reports the first sustained blur, right? So amplitude of accommodation, you measure it binocularly. You can see the patient's both eyes are open. So first you measure it binocularly, okay? Then you can measure it uniocularly also. You cover the left eye and measure the right eye's amplitude of accommodation. You cover the right eye and measure the left eye's amplitude of accommodation, okay? So basically amplitude of accommodation in the RAF ruler, there are like 4 sides, right? One side it is written in diopter, so you can measure the accommodation in diopter. Basically we measure the accommodation in diopter, in amplitude of accommodation, okay? And one of the side it is mentioned in centimeter, right? Other one side there is age of the patient. So it also shows that what is the amplitude of accommodation which should be normal for the correct age. So suppose a patient is a 15-year-old patient, so maybe he needs to have an amplitude of accommodation around 12 diopter. So you can see that whether it relates to that, okay? So for distance, not for distance, so for binocularly, suppose you have got a 12 diopter, monocularly you can get a lesser amount of amplitude of accommodation, okay? So for measurement of amplitude of accommodation, we compare it with Hofstetter's formula, okay? Hofstetter's formula is like, how can you be very sure that it corresponds to the age of the patients? Means if the age of the patient is 15 years, okay, so what should be the correct amplitude of accommodation? So to calculate that, there is one formula called the Hofstetter's formula. Hofstetter's formula is like 18.5 minus 0.3 into age, right? So 18.5 minus 0.3 into age, right? So suppose the patient's age is 10 years, okay? Suppose the patient's age is, wait a second, waiting room, someone is there. Okay. So suppose the patient's age is 10 years. So how to find out what should be the correct amplitude of accommodation for this age? So 18.5 into 18.5 minus 0.3 into age. That means 0.3 into age means 0.3 into 10. Suppose the patient's child's age is 10 years. So 0.3 into 10 is 3. So the amplitude of accommodation should be 18.5 minus 3. That means it should be around 15.5. Okay, so anything less than that, if the patient, if you are getting any accommodation is lesser than 15.5 for a 10-year-old child, okay, so that means it might lead to, it may be an accommodative insufficiency, okay? So suppose for the 10-year-old child, that means you need to have an accommodation of 15.5 diopter, right? So the child is having around 14 diopter accommodation. 14 diopter accommodation means his accommodation is little bit lesser as compared to his age. Okay, so that's how we record the accommodation, and that's how we like compare it with the age, like age factor, like whatever age the patient is, accordingly he should have the amplitude of accommodation. Okay.